Should a foot orthotic be rigid or flexible? The answer is yes, because the question is completely misstated. The way any first-year engineering student would restate this question, they'd say, okay, you're asking me if I take a curved piece of some material, plastic for example, and put it on a flat surface, how much vertical force should that plastic exert on the human body? You know, that's pretty easy. The answer is Newton's third law. For every action, there's an equal and opposite reaction. If you want me to tell you how much force the orthotic should apply, how about you tell me how much force you're going to apply to the orthotic? Well, our extensive research in the field of biomechanics has shown us what creates the downward force, and we've discovered it's caused primarily by donuts. It's what you weigh. Secondarily, how flexible are you? If you have an extremely flexible foot, then the ligaments are not helping, and the orthotic has to apply a greater force to control the arch. In a very rigid foot, you're already held in place. The orthotic doesn't need to apply so much force. So foot flexibility is an important factor. Well, what factors cause the plastic to apply an upward force? There are many, many factors. Included are the type of plastic you use. We call that the modulus of elasticity of the material. How thick is the plastic? Thicker plastic will be more rigid. How does that thickness graduate into the arch? How long is the foot? You're putting in a ceiling joist. You're only going to go 2 feet. Use a 2x4. You're going to go 6 feet, you better use a 2x6. Longer spans require more support. How high is the heel cup? Deeper heel cups are flanged and bent, which gives them stiffness, as well as bridging from the heel to the arch. How wide is the orthotic? A wider orthotic spreads the force per unit area over a greater area, changing the characteristics of the plastic, or how rigid it needs to be. How high is the arch itself? I'm not talking about the foot, I'm talking about the plastic. How high is the arch of the plastic? A higher arch will have greater vertical component to the tangent to the curve. What is a tangent? It's perpendicular to the radius. So if you were to imagine a circle here, and this being the radius, this is the perpendicular. So if you looked at the tangents to the curve, a higher arch will have greater vertical component, a lower arch will have a much smaller vertical component, and the sum of those vertical components is the resistance to downward compression. So you've got to take all these factors into account when you're making an orthotic and designing an orthotic. What we did was relatively simple. We matched the downward and upward forces. For the first time in history, we actually made a foot orthotic that was truly custom. What is truly custom? I mean the actual shape of the foot. You look at our orthotic and you say, ooh, did it fall out of the ugly tree and hit every branch on the way down? And then you match it up to that foot and you go, ooh, it goes to that ugly foot. It fits perfectly. In fact, it fits so perfectly that it's in full contact with the foot, which gives it enormous efficiency. Then it's calibrated to deliver exactly the right amount of force and flexibility for that individual person's body weight, for their flexibility, and for their activity level. And most importantly, it does not put the foot in a neutral, ineffectual position. It puts the foot in the maximal amount of arch in the subtalar joint to allow for stabilization in the sagittal plane, allowing for a propulsive gait, the maximal arch subtalar stabilization position. But how does it change the gait cycle? Remember? by preparing the foot for heel contact, increasing the degree of supination at heel contact, which levels the anterior facet, preparing the foot to hit the ground, causing a dampening effect, slowing down pronation. And it has to be individual, left to right. What if the person had a motorcycle accident, surgery, a fusion? They changed the range of motion. They had Charcot-Marie tooth disease, polio, Charcot foot. Congenital differences were not symmetrical. An orthotic should not be a perfectly smooth, idealized curve that are perfect mirror images of each other. Orthotics need to be individual, left to right.